I'm Dr. Atul Mishra. I'm the Chief Orthopedic Surgeon here and working as Additional Director and Head of the Department Orthopedics at Fortis Hospital, Noida. Look, any patient who has a degenerative joint disease, that means the knee joints, they are damaged and beyond repair by regular means of conservative management and physiotherapy. All those patients who have severe to moderate to severe arthritis in the knee joint, they require knee replacement surgery. Knee replacement surgery is actually a lifestyle surgery. Patients who are not able to perform activities of daily living, they are not able to go to the toilet, they are not able to go to the malls, market, they are not able to go to the parks along with their grandchildren. All such patients who are devoid of these simple pleasures of life, they require knee replacement surgery. And in this knee replacement surgery, we remove the worn out cartilage. If you look, this is the model. Here, this shows how a knee replacement works. The cartilage which is there on the surface of the bone above and the bone below, these cartilages, they are destroyed as a process of degeneration. We scrap off the residual cartilage, we raw the bone, and we put a new surface like this on the bone above and a new surface like this on the bone below, and in between these two surfaces there is a high density polythene. So once the new surface is there, it glides smoothly and freely like this on the high density polythene. This is all about how a knee replacement surgery is done. The recent advances in the knee replacement surgeries are: first, this knee replacement surgery was actually designed for Western patients. And this technology, once it was tested in the West, it came to India. The Indian patient is different from the Western patient because the Indian patients, as a result of our culture and religion, they want more bending of the knee joint. The patient who wants to sit in front of the puja ghar daily in the morning, or the person wants to go for the namaz, so they want high flexion. High flexion means the knees should bend. A conventional knee replacement, the knee bends only by 90 to 110 degrees, not more than that. The recent advances are, with a better design, the knee flexes up to 150 degrees. So if the knee is able to bend by 150 degree, the religious sentiments of our patients, the cultural sentiments of our patients, they are preserved. Secondly, the knee which is given to us by the God, if it gives way after 60-65 years, it degenerates. Naturally, the knee which we implant, it also fades. So wear and tear, we want a knee design where the wear and tear is less. So the new technology which is here in India, and we have adopted it and we are routinely doing it, that is the ceramic. This is the model of ceramic. It actually is like this, black in color. The surface of this ceramic is very smooth. So in lab testing, it has been proved that this sort of knee, which is ceramic, the wear and tear of this polythene is less, and this knee, it can go up to 30-35 years. While a conventional knee, the old model which was there, it lasts up to 10 to 12 years. So this is the new advancement. Another advancement is we use computer-aided navigation system. A computer-aided navigation system, it helps the surgeon to put this knee implant of the most appropriate size and in the most appropriate way to be implanted in the body of the patient. Naturally, if the implant is of normal size and it is implanted in the way it is designed according to the morphology of the bone of the patient, it is going to bend more, it is going to last more. So to enumerate, these are three: the design, the new materials, and the new devices which help in putting this knee in the patient. These are the three things which are most recent advances which are around the corner. If a patient undergoes knee replacement surgery, then there are two types of patients which we have. We do a Oxford knee score and the psychosomatic testing of the patient, and if we find that the patient is strong-willed and the patient is able to do the activities, the patient has a very keen desire to get out of the bed and walk, such patients, they actually don't require any physiotherapy after surgery. Routinely, some patients who are so diseased that they can barely walk and they come to us in a very far advanced stage, such patients, they require physiotherapy for at least 1.5 to 2 months after the surgery. The only precaution which we suggest to the patient after knee replacement is not to squat. Not to squat means avoid using Indian toilet, because that gives a lot of pressure on the implanted knee. Rest otherwise, the patient is able to perform and do whatever they like. They are able to do treadmilling, they are able to play golf, they are, if they want to jog, they can do jogging. As such, there is no restriction. During recovery after surgery, we expect that there is a family support to the patient, and we counsel the patient and the family before that. A 65-year-old lady will be able to perform daily activities like going to the toilet, getting out of the bed, going to the kitchen in roughly around 10 to 15 days comfortably without the help of family members. All we require is that somebody is there to prepare food for them. Rest all activities we ensure that the patient is able to do once the patient is discharged from the hospital. And most importantly, two activities: getting out of the bed and with the help of walker taking a stroll in the drawing room, and second, getting out of the bed, going to the toilet independently and using the toilet. Knee replacement surgery is the most I would say successful procedure in orthopedic practice, and if it is done in the right patient, by the right surgeon, in the right hospital setup, it is a perfectly safe surgery. A implanted knee, as I had described previously, a regular implanted knee has a lifespan of 10 to 12 years, but with the new biomaterials coming in and with the new surgical techniques with more accurate positioning of the knee joint, we can expect this implanted knee joint to last at least for 30 years.